Hi, everybody. We're just going to wait a few minutes for our fellow live streamers to join. Great. We're getting close. We have the countdown. It's 8:57. We're going to wait just a minute or two more. I don't want people to miss all these wonderful questions, and they're starting to come up now. And keep sending us your questions. We got some questions that came to us before the chat tonight, and we're going to address a bunch of those and a bunch that show up through the chat. So send in your questions. They're great, and there's not a question I won't answer. So I just hope we can get to most of them as we can. So we'll just give a few more minutes until the clock strikes 9 Eastern time, and then we'll get started. But I know we have people from all over the world today, so that's exciting. What we'll do is at some point talk about what are called the circadian dysrhythmias, or about all those jet lag disorders, which are interesting and fun from all over the world. And for those of you who are looking at the screen and don't see my ears, I do have ears. It's just the background doesn't recognize them. So I'm not dysmorphed. I'm just watching my watch here and keeping an eye on our time. All righty, we're getting closer. All righty, it's almost 9 o'clock. I think we could probably get started. We have a bunch of people online, and I'm just going to start with an introduction anyhow. And most people don't want to hear that; they want to hear the answers to all the questions that we have. So um, before I introduce myself, I first want to truly thank our friends and partners over at ShutEye, Kitty, Betty, Ray, that whole group. They're just a wonderful group of people to work with, and I will say it's just wonderful to work with them and be their sleep medicine partner, because they truly care about adding this value to their ShutEye participants, and especially some of their subscribers. So again, we're really happy and pleased to be working with ShutEye. And my name is Dan Rifkin. I'm a physician. I've been practicing sleep disorders medicine for more than 20 years. Yes, I have a lot of history in this field. Initially, I was a neurologist, did specialized training in sleep medicine, And again, I've been practicing for quite a while. So that's why these questions that come up, I've heard a lot of them, I've seen a lot of them, and but there's always some that I haven't seen. So they're always fascinating to see them come through. I am gonna just basically get started. We started our first live stream with a bit of a lecture, kind of going over what sleep apnea, or excuse me, what sleep is, what sleep apnea is, what insomnia is. We went over different sleep disorders. It was a bit boring, but we had to lay that groundwork. So I'm not sure if the video is still on the YouTube, the ShutEye YouTube, but it's a good foundation to learn about sleep. And then the last one we did was on just the exact same form we're going to do now and probably do going forward. We're going to take questions from all you watchers and listeners, and we're going to answer them. And we're going to answer them to the best of my ability and the best of my knowledge, and just hopefully give you some insight. So again, thank you all for joining us tonight. We're excited to be here, and we're excited to teach you a little bit about sleep. So I'm going to start with the very first question, which comes from one of our participants named Money. He says, I keep feeling tired during the day in the afternoon and feel like I need to take a nap. When I take a nap, I end up sleeping for an hour or two and feel bad when I do wake up. What to do about this? So that's interesting. That's actually a great question because, we have this thing called our circadian rhythm. This is a rhythm that basically tells us when we should be awake, when we should be asleep. And it basically gives us that drive to go to sleep. And we have this sleepiness that occurs at nighttime, but we also get some sleepiness during the day. And that's the normal rhythm of our body. We all feel that. But some people have this tremendous drive to fall asleep in the afternoon. Like it's almost like hitting a brick wall. And if they don't sleep, they can't function. And it might be a situation where you're not getting restorative sleep at night. You're not getting enough sleep at night, and that drive is really great. I mean, whole societies take naps. I mean, you've heard of siesta and the Spanish word. It's a Spanish word for taking a nap in the middle of the day. It's a very common thing. But for those of you that feel that brick wall and you go to sleep, taking a long sleep can be almost worse. It can be detrimental because the amount of time you sleep will dictate the time that you get out of sleep in what stage. So when we go to sleep, we sleep in various stages. They're characterized into what's called non-REM sleep and REM sleep. And non-REM sleep is divided into further stages called stage N1, N2, and N3. And if you sleep 60 minutes or longer, it's a really high chance that you're going to wake up out of N3 sleep, which is delta sleep. It's a very deep sleep. This is the kind of sleep where people sleepwalk in. They'll have confusional arousals. They'll engage in actually automatic behaviors that look like they're awake, but they're actually asleep. It's such a deep, deep sleep. So if you wake up out of that stage, you'll feel sometimes terrible, like you just need to keep that sleep going. And there's a name for that. They call it sleep inertia. Like you just feel like you have to keep sleeping. So what you should do about it is that if you take a nap, set your Apple Watch or your cell phone and just set an alarm for 20 minutes. Take a short nap. You want to keep that nap 15 to 20 minutes at the longest. And if you can, great. And you'll see that when you wake up, you'll feel much more refreshed. So that's just a little bit of advice for that problem. But if you're feeling so tired that you have to take a nap or you have that brick wall feeling, then that might be again an indication of an underlying sleep disorder where you're getting a non-restorative sleep. So you'd want to talk to your doctor. You might be a perfect patient for Ognomy, where you can download our app and see one of our board certified sleep doctors. So make sure you address that or try those naps first and see if that helps. So I'm going to move on to the next question from Adam Omar Alami. This is a great question. How does sleep affect heart health? All righty. So, this is a topic that's been going on for a long time. In fact, there was The first study that actually got people really interested in sleep medicine was this sleep heart health study that was back in the 90s and 1990s and the turn of the millennium. And we really wanted to look at various aspects of sleep and heart health, and we've learned a lot over the years. Some of the more recent newspaper clippings that you've probably read and newsworthy events on just about how much you sleep can affect your heart. If you sleep too little, under 7 hours of sleep per night, there have been studies that actually show that it affects your heart. And the way it affects your heart is through cardiovascular disease like high blood pressure or having a heart attack or stroke. Can even affect diabetes, being at a greater risk for diabetes. So sleeping less than 7 hours can affect that. But also, it's sort of like a U-shaped curve, right? So on the two ends of the spectrum, on one tail, if you sleep too little, it can affect your health. But if you sleep too much, like for those that sleep more than 10 hours, that could also affect your heart health. So your heart health. So you have to kind of get into that sweet spot of about 7 to 8 hours of sleep. There's some new studies that really want you to keep it around 7 hours, and that will be best for your health in terms of duration of sleep. But there are other disorders of sleep that can affect your heart health. One of them is sleep apnea, and that's another disorder that the sleep heart health study identified as associated with heart disease. And what sleep apnea is, that's a disorder of breathing when you sleep. So when you fall asleep, that throat muscle, it's just a muscle like other muscles in our body. It'll fall asleep and relax. So when the throat relaxes, it'll flop on itself and snore. But sometimes it gets so floppy that it actually collapses. So when you try to breathe through that collapsed throat, you can't get the air through, and your brain senses that, and your brain says, "Uh-oh, I'm not getting enough air. I better wake up." And when your brain wakes up, the throat naturally opens. But the clincher is your brain has to be awake for like 10 to 15 seconds before you know you're awake. So what happens with the sleep apnea, you wake up for just a second, but then you go right back to sleep, and you wake up, go back to sleep, and you wake up, go back to sleep, and you do that repetitively all through the night. And the way they feel that this affects heart health is all different kinds of ways. But when you're not breathing, you're not getting enough air in, your oxygen level falls, so that could be detrimental to the heart. But also when you're not breathing, your heart slows down. Your body detects that you're not getting enough air, so it decreases your heart rate. And then once you wake up with that gas, the heart rate increases. So all those times your heart rate is slowing and increasing and slowing and increasing all through the night, when in fact that should be a time when you're quiescent or relaxed or in a state of calm. So they feel that, sleep apnea or even the sleep deprivation, even sleeping less than 6 hours, kind of raises that tone of it's that subconscious nervous system. You hear of that fight or flight mechanism. It's called your autonomic nervous system. This is the part of the nervous system that you have no control over. It's basically raised up a little bit. So what'll happen is that when you don't have sleep apnea, or you're just normal and you have normal sleep, you go to bed, your blood pressure dips a little bit, your heart rate slows a little bit, you go into this calm state. So the first thing that happens with sleep apnea is you become a non-dipper. You don't dip your blood pressure, you don't dip your heart rate. That level of calm doesn't occur at night. So what'll happen is it'll translate into the daytime. So that lack of calm at night, now you have a little bit elevated uh, stress during the day from not sleeping at night, and then it keeps on cascading and making things worse. That autonomic nervous system, you've probably heard of like epinephrine or norepinephrine, like these stimulating hormones, that these kind of circulated at a greater degree. Another one would be cortisol, which is also known as the stress hormone. These are all raised up in the setting of sleep apnea or sleep deprivation, and they feel that that's how sleep affects the heart health. At least that's our current thinking. All righty, I'm going to move on to the next question. This next one is from Victor Manuelle Madera Torres. And it says, "What's the best way to get rid of sleep apnea?" All right, good question. Well, once you have it diagnosed, it's really important that you work with a sleep medicine provider, right? So that you're not trying to deal with this on your own, or buying oral appliances off the internet, or trying to buy CPAPs off of Craigslist or something like that. You want to work with a professional, because again, we just talked about how untreated sleep apnea is a major cardiovascular risk, and you want that expert advice to take you on that journey. And again, this is where Ognomy, I'm not trying to sell Ognomy, but it's a great platform to address sleep apnea with board certified practitioners to kind of like guide you on that journey for sleep apnea. But it's everybody's different, and everybody has different degrees of sleep apnea. So when we diagnose sleep apnea, first you're stratified into certain levels. You can have mild sleep apnea, moderate sleep apnea, or severe sleep apnea. And the way we define that is basically how many times per hour your throat's collapsing down. So if you collapse your throat 5 to 15 times per hour, it's mild sleep apnea. 15 to 30 times an hour, it's moderate sleep apnea, but greater than 30 times per hour, it's severe sleep apnea. Now, you notice I said 5 to 15 was mild. Well, what about under 5? Everyone's allowed to have a little bit of sleep apnea. That's okay. For whatever reason, the throat might, as you relax, you'll have a little bit, but it's not clinically significant. So you're allowed to have a little bit. But once you get more than 5 per hour, you're diagnosed with mild, and then it kind of works its way up from there. So we use different treatments for the different degree of sleep apnea. So really, most of you have heard about CPAP, or continuous positive airway pressure, which is a treatment for sleep apnea, which everyone hears about, and everyone says, oh, there's no way I could wear that. It's too big. It'll fit on my face, all these things. When in fact, it's really not. The interfaces are very small. There's little pillows that fit underneath the nose, small ones that go around the nose, and everybody's different. But it's really a great first line therapy for significant sleep apnea, and to whatever degree. Because when you're using CPAP, or that continuous positive airway pressure, it sends a whole column of air from your nose into the back of the throat that's collapsing, and just keeps that throat open the whole time. So no matter where you're collapsing, either behind your nose, behind that little punching bag in the back of your throat called the uvula, or the base of your tongue, that CPAP will keep that whole airway open. Other treatments, for example, like the oral appliance for sleep apnea, it brings your lower jaw forward a little bit. And when it does that, it brings your tongue forward, because your tongue is attached to this lower jaw. So by bringing that lower jaw forward, it brings the base of the tongue away from the back of the throat, and just makes that throat bigger, and it's less apt to collapse down. This is also a great treatment for certain patients, but you also sometimes want to have some certain characteristic and features. Like, for example, you might want to have an overbite like me. So, that tells me that the base of the tongue is sitting back a little bit. You might have a certain molar occlusion or something that makes you a good candidate for that oral appliance. So that's also an option for sleep apnea. There's also alternatives now. Like, we used to have surgical alternatives that really didn't work. I mean, I told you guys, I've been doing this for 20 years. Believe it or not, when I first started, they were basically cutting out that uvula and soft palate. It was called uvulopalatal-pharyngeoplasty. It was this horrific surgery that was really uncomfortable. And although it worked a little bit initially, they found that the long-term effect of taking that uvula and soft palate out was just not good. And it didn't really treat your sleep apnea, but it caused other problems like snarfing. So if you have a drink of milk or beer, whatever you like to drink, it'll come out your nose. So we don't typically recommend that surgery any longer. But there's a newer surgery called Inspire therapy, which is a hypoglossal nerve stimulator, and that's just a fancy way of saying it stimulates the nerve to your tongue. That's the hypoglossal nerve. That's the nerve that goes to your tongue, and it stimulates it. And instead of bringing the jaw forward to bring the tongue forward, this stimulates the nerve to bring the tongue forward, and it gets implanted. It's a great treatment for patients with moderate to severe apnea that really had a hard time tolerating the CPAP and couldn't wear it. So at least now we have options for that, because before, really the only way to get rid of sleep apnea in a very severe patient that couldn't wear CPAP was actually to do a tracheostomy. So we now have really nice therapies. It wasn't only that, there was something called the mandibular maxillary advancement surgery that you have to break the upper and lower jaw and bring the whole jaw forward. So again, not something we recommended too often, but for patients with severe apnea, again, because of that cardiovascular risk, we really wanted to look to ways to treat it. So the Inspire therapy is a really great addition to our armamentarium to treat sleep apnea in severe patients. So great question, Victor. Okay, the next question. This is from Debbie Simmons. All right. I heard it was best to tape your lips to practice sleeping with your mouth closed. Is that true? Well, I haven't heard about that as being the best way to keep your mouth closed. I have a better idea. What you can do is actually put your tongue on the roof of your mouth. Now, if you put your tongue on the roof of your mouth and try to breathe through your mouth, you can't do it. You're forced to breathe through your nose. And I usually tell this to patients to practice even before they try that CPAP mask, because that air kind of blows in through the nose and into the back of the throat. And it can be a little discomforting initially when you first try it if your mouth is open, because the air will come in the nose and out the mouth and it feels kind of weird. So the best thing to do is just put your tongue up on the roof of your mouth and concentrate on doing that throughout the day. And when you do that, it kind of forces you to breathe through your nose. So that's probably better than taping your lips closed, because the reason why I want to keep our mouth open is just in case, right? Some of you drool when you sleep, God forbid you throw up when you sleep, who knows? You just want to make sure that that mouth can open when you're sleeping. So it's never something that I would recommend that you do. But great question, Debbie. Thank you for that one. Okay, this next question is from yes I am, or yes I am one. Okay. Yes you are. How many people die in their sleep from sleep apnea? Why can't you just buy the machine over the counter? Oh, okay. That's a good question. The I mean, how many people die from sleep apnea? We don't really know that absolute number, of course. And most of the time, believe it or not, you don't die from the sleep apnea event. Like if you think about it, when you're having sleep apnea, you you're not getting the air through, but your brain recognizes that, right? So you're just the same way you can't hold your breath while you're awake, right? If you try to do that, you'll pass out, but then you start breathing, right? The same thing will happen when you're asleep. If you're not getting air in, your brain wakes up, and when your brain wakes up, you take the breath. So your body's pretty good at correcting that. The issue is the repetitiveness of that collapse of the airway and that constant disruption during sleep that gradually leads to the problem of sleep of mortality with sleep apnea. And we know that untreated sleep apnea truly increases the mortality of people. I mean, if you have sleep apnea, you don't treat it, you die earlier. I mean, it's just these studies I've probably read 4 or 5 large epidemiological studies that show that. Now, they're epidemiological, meaning that they're not necessarily, they're associated. So, but not necessarily causal, meaning that we see this phenomenon, but we haven't done studies to really declare, is it the sleep apnea that causes early death or other things associated with the sleep apnea? You try to account for everything doing regression analysis, but you really can't. So we have to do more studies to look at the mortality associated with sleep apnea. One of the things that I didn't mention during that heart sleep apnea in the heart, but it can also induce an arrhythmia of the heart. A specific one is atrial fibrillation, where the heart it's very irregular, the the way it beats. So that's another big risk. And so the issue again isn't the event itself, it's the constant nature and that constant repetitiveness of the apnea that's bad for your body. And the reason why you can't just buy the machine over the counter is because it needs to be set at a certain pressure. And believe it or not, everyone thinks like CPAPs, like we prescribe the different types of masks and the hoses and the tubes. The doctor really prescribes the amount of pressure of air. And that amount of pressure of air sometimes has to be adjusted. And if it's too high, it can actually induce something called central sleep apnea. So we talked about obstructive sleep apnea, where the throat snores and then collapses. There's another type called central sleep apnea, where the throat stays open, but your brain just doesn't take a breath. And, and that can last sometimes for prolonged periods. That can be associated with the low oxygen level. And it can actually be induced by too high of a CPAP pressure. So it's something that's, prescribed right now by doctors. But I will tell you, and I'm a firm believer of this, I think in time, you'll be able to buy a CPAP over the counter. And the reason why I say that is because there are more than 1 billion people in the world with obstructive sleep apnea, and the vast majority remain undiagnosed. We at Ognomy, that's a big mission of ours. We're trying to tackle this disease to stomp out the downstream heart disease effects and all those other things. But um, it's probably coming down the pike because of just the sheer number of patients that need treatment. But addressing the earlier question, like what's the best way to treat it, like CPAP might not be the best treatment for you as an individual, and that's why you need to speak to a sleep medicine professional, um, preferably someone board certified in their field, so that they can give you the best advice and you can come to some shared decision making on what would be the best treatment for you. But really great question there. Yes, I am. Sam, I am. All right, the next question is coming up. It's from Jen Mohney. So we had our first question from Money and another one from Jen Mohney. I think we have a little bit of a theme here. Does a weighted blanket really help if someone has a hard time sleeping? Okay, so weighted blankets. I was kind of waiting for a question to come up on weighted blankets because they've been around a long time, and I will be the first to tell you that I'm not this like super expert in weighted blankets. But for those of you who don't know what weighted blankets are, that they're basically like they're blankets that are heavy. Like they range from like 5 pounds to actually 30 pounds of weight that gets wrapped around you, kind of like a swaddle of a baby or even like a strong hug. And this has been shown to kind of elicit what is like a deep pressure stimulation. And we know that like when you get a hug from a human, and it'll increase the serotonin levels in your brain and other neurotransmitters, and there have been some studies to show that it can actually help with sleep. Now, when I say some studies, they haven't been the best, and they haven't really, there really hasn't been enough to say that using weighted blankets help with insomnia or people that can't sleep. I think there's better research to show that it's very helpful if you have anxiety or if you have PTSD, or it's like certain populations seem to benefit from the weighted blanket. But its direct effect on insomnia, I think the jury's not out yet on that one. And I'll certainly keep you up to date as I hear more about the weighted blankets. But um, um, they they I'm never a big fan of recommending something that isn't evidence-based. And you can go into the literature. In fact, there was a systematic review, which is a way that we look at literature, which went in and looked at all the studies on weighted blankets and insomnia going back in time. And I think there were maybe only 8 studies and on insomnia, and they weren't really robust. So I don't think the evidence is there yet, but we'll keep an eye on that one. So, so if I find out more, I'll put something in on the ShutEye chat and send it your way. But that was a nice question, Jen. Okay, the next question from Daniel Selig or Selig. Hello, how do you feel about nasal strips? How do I feel about nasal strips? I feel pretty good. No, honestly, nasal strips, for those of you who don't know, those breathe right strips, they kind of fit on your nose, and then they basically lift your nose up. So if you collapse these are the nares here, that if you collapse that area when you sleep, it'll kind of open up your nares. And just anything to open up that hose sometimes can help you breathe better, especially if you have a lot of nasal congestion. But is it a direct treatment for a disorder like sleep apnea? Probably not. Will it help just primary snoring, sort of like a precursor to sleep apnea? For some people, absolutely. If most of that snoring is coming from the back of the nose or due to the narrowness of the nose. And for those of you who remember in your physics class, remember the size of the diameter was inversely proportional to the resistance of air, but it's like to the 4th power. So the slightest change in that diameter will have a great effect on resistance, and the greater resistance will cause greater turbulence in the nose. So if you can open up that airway a little bit more and make it bigger, make those 2 nostrils big with that breathe right strip, it should certainly help with your breathing at night, and does help some patients with snoring. Again, not the greatest treatment for sleep apnea, so wouldn't recommend it for that. But so that's how I feel about nasal strips. Okay. This is awesome. There are so many great questions, and the beauty is, I think I'm gonna get through a bunch of them. I know we only have about 20 minutes left, but I'm there's so many that are coming through. I'm happy to kind of not spend too much time, but just try to get through as many as I can. And for those of you that need a break, don't leave because there's even better questions coming up. So, all righty. The next question is from Usman Mohammed. He said, "Why do I have a lot of saliva in my sleep?" That's a great question. Um, you know, Saliva, you might be dreaming about really good food. Just kidding. Some people have a lot of drooling, and it could just be a manifestation of mouth breathing when you sleep. But it's actually one of those questions we ask as a potential symptom of sleep apnea or sign of sleep apnea. Because when you have sleep apnea, you start snoring, you do a lot of mouth opening, and when your mouth opens, it can lead to some dryness, and then subsequently you start to produce saliva. So if you have a lot of mouth dryness or a lot of mouth opening when you're sleeping, you'll start to induce saliva. So saliva is induced by food and by irritation of the airway. So check on those things. And if you're dreaming about really great food that's making you have hypersalivation, that's the fancy name for too much saliva, hypersalivation. Let me know what you're dreaming about and what the food is, because I love food and that would be a lot of fun to know. Okay, the next question from Dee Bird. Why is it so hard to fall asleep when you're so tired? 1 minute I can't get enough sleep, and the next I sleep way too much. That's a really interesting question. You know, and this kind of gets to, for those of you who were with us last time, we talked about insomnia. And believe it or not, the harder you try to fall asleep, the more difficult it becomes. And that's because, like, our subconscious brain, that brain that we talked about a little bit, that's our fight or flight mechanism, it really needs to know that when we go to sleep, it is a really great environment and we're not going to get attacked by a saber-toothed tiger. So subconsciously, we're just animals, right? And subconsciously, we just need to know that environment is really good for sleep. And a lot of times what will happen is you'll be super tired, but you've been having trouble with your sleep, and the moment you even go to your bedroom, your brain wakes right up, and you go into what's called a hyperarousal state, because hyperarousal state because your brain is worried that a saber-tooth tiger is going to get you. Now I know I'm just speaking figuratively, but that's what it is. It's that subconscious nervous system that's too heightened. Our fight or flight mechanism is too engaged, and we just can't seem to fall asleep. And the harder we try, the more difficult it becomes, because you can't just say, okay, go to sleep. The environment has to be conducive for sleep. You have to be super sleepy, but also it's the environment. It plays a really big role. And I'm going to address the next part of the question. 1 minute I can't get enough sleep, and the next I sleep way too much. I think that's kind of pretty much the same. So I'm going to move on to the next question. But if you're sleeping too much, you probably want to address that. D. I would definitely speak to a professional about that. I would talk to your doctor, or again, you can meet us up on Ognomy. We'll address that there. So the next question. This is from a ShutEye app user. Is it okay to watch something before sleeping? That's a good question too, because it's okay to relax before bedtime. It's okay to kind of get into a state of relaxation, because we call that facilitation to sleep onset. There's this period of time when our brain needs to relax, calm down, and then go to sleep. It's really hard to kind of be going bang bang bang, just kind of doing everything that you need to do and being super active, exercising, whatever it is, boom bam boom that, this that, and then all of a sudden you want to go to bed. Your brain's not ready. You have to kind of facilitate sleep onset with this sort of quiet period before bedtime. But watching something may not be your best choice, because by watching something, you're actually sending light into your eye, and in the back of the eye, there's something called the retina. And from that retina, there's a tract that goes right into the middle of your brain called the suprachiasmatic nucleus. Say that 5 times fast. But what that tells you that maybe the sun's coming up, and that's that part of your brain, that's your clock mechanism that sets that rhythm of your body of sleep and wake. So if you show your brain too much light as it's close to bedtime, your brain gets confused and it doesn't know if it should be awake there or asleep there, and you don't secrete that hormone of darkness called melatonin. So that light going into your eyes will suppress melatonin, and it will reduce some of those things you need to fall asleep. So my suggestion to you is to get into that relaxed state, but read something. Don't read it on a Kindle or your iPhone, but read it, like, get back to a book, or a magazine or a newspaper with some dim light behind you, and read that way. You'll find you'll be able to fall asleep quicker and have probably a better sleep onset experience. So stay away from electronics before bedtime if you can. It's I always tell patients you want to keep TVs out of your bedroom, cell phones out of your bedroom, Kindles out of your bedroom, and iPads out of your bedroom, anything that's going to send direct light into your eyes. Now, there's this phenomenon of blue light blocking, which does work. I mean, they found that blue light is that greatest wavelength that'll set that circadian rhythm. It's called a Zeitgeber. It sets that rhythm, the blue light. So wearing a blue light blocker might be helpful to you if you really got to watch stuff. But again, my suggestion would be, let's go old school. Let's start picking up some books and throw some incandescent light behind you, and read in a really comfortable couch or chair. All righty. Thank you. That was a nice question, and it came from one of our ShutEye app users. So pleasure to have you on tonight. Okay, the next question, and this is also from a ShutEye app user. We're in a trend here. It says, I cough a lot in my sleep. What are the reasons why, and what can be done? Again, this is one of those things where I would certainly recommend talking to your doctor about, or again, you can sign up on Ognomy and see one of the doctors on there, because coughing during sleep can be a sign of nocturnal asthma. Some people have asthma throughout the day. Some people have it just at night. And some people that have it during the day gets a lot worse at night. But the other common cause is reflux. Some people will get reflux when they sleep. This is when some of your stomach fluid comes up your esophagus and into the back of your throat and induces a cough. And also sleep apnea. That's another one. Sleep apnea, you'll be waking up coughing because, again, that throat collapsed down and you're like trying to get air in. You finally wake up, and sometimes it lasts so long that you wake up and you're almost like in a state of air hunger, like you feel like you haven't got enough air, and you start coughing and trying to get in as much air as you can. So if you're experiencing a lot of coughing when you're sleeping, again, definitely start off. I would probably say talk to your primary care doctor, and see what they have to say. If you're not getting a lot of answers there, feel free to talk to one of us on Ognomy. And Ognomy is really easy. You just go to the App Store, you type in Ognomy, you download the app, and you can schedule an appointment. We made it really simple. You can also do it on the web too, so on a web browser. The next question is from Gracie. It says, hello, I'm worried about my snoring. I've woken up with chest aching, tight, concerning. Yes, concerning. That's very concerning. I would say, Gracie, tomorrow morning I would call your doctor, and I would absolutely, you know, talk to them about your experience, because let's say, a lot of times people with sleep apnea, it's the hallmark and one of the signs of sleep apnea. But if you're actually waking up with like a feeling of chest tightness, and pain, that could be much more serious. And in fact, if it's happening and the pain doesn't go away, I would just immediately tell you to call 911, because that could be a sign of a significant heart problem. Or it could be just reflux from sleep apnea, because when your throat's collapsed down and you're trying to take a breath in, you can't get that air in, and you're creating this negative pressure in the chest. And when you do that, you're actually kind of creating this vacuum in your chest, and you're pulling stomach fluid up. But I would say again, Gracie, that you really should definitely go ahead and talk to your doctor about that tomorrow morning. Okay, I think we're coming close to the end tonight. I'm gonna basically send one more question. And when we're done with this question, we're going to wrap it up until next time. And this one is, what's the best vitamins to aid in helping insomnia? That's a great way to end, Tabitha. Basically, I'm not a big fan of using any kind of medication or pill for insomnia. Insomnia can be really treated through behavioral change. And maybe we'll spend one of our live streams really going into a deep dive on what's called cognitive behavioral therapy, or it's called CBT, and CBTI, or cognitive behavioral therapy, specifically for insomnia. And these are ways behaviorally to treat your insomnia. There's melatonin that a lot of people take that can be helpful to some. But in terms of vitamins, really nothing out there evidence based. And like I told you before, I'm a big fan of really using the literature to kind of drive the guidance that I give my patients. So I think, to end on that question is a good one, because I want people to know that we'll do a live stream really on insomnia, because it's such a common problem. I mean, 50% of adults will get a bout of insomnia at some point in their life, really, truly. And 1 in 10 have chronic insomnia. It's a very common problem. So we'll certainly, address that. For sure. So with that, I think that's all we have time for tonight. But, again, I just really enjoyed answering your questions, and I truly, truly look forward to the next live stream. This is really fun. I'm having a great time giving you guys advice, and you're throwing me some real great questions, and I'm enjoying it a lot. So, and if we didn't get to your question tonight, we'll certainly try to get to it next time. Put it back up on the chat, and we'll try to get to it. So thanks again for joining me tonight. Have a great weekend and a super restful sleep. I'll see you next time. Take care.